Most people don't think twice about their morning bathroom routine, but for thousands of Americans, it's a more complex process. We're talking about people who need to use urinary catheters. Why does this become necessary? Doctor, can you give us a little more insight to that?
Well, Erica, not everyone has the freedom to urinate when they feel it's convenient. Some people have a condition called urinary retention, resulting from nerve injury to the bladder, which prevents the bladder from emptying voluntarily. Others have the opposite condition called urinary incontinence, in which the bladder empties freely without control, which can happen at very inconvenient times.
And we know these kinds of problems can cause inconvenience, they can cause pain, embarrassment, and even mood swings. But our guests today are here to show us how new catheter technology can help people better manage urological issues. Let's welcome Mary Wasner, a registered nurse with a special training in urinary problems, and Dale Spencer, a patient who has a personal story to inspire those who deal with this every day. Welcome, Dale. Welcome, Mary. Thank you so much for joining us.
Thank you for inviting us.
Well,
Glad to be here.
Mary, let's start first with, when would a person need to use a catheter for the long term?
There are many reasons. Neurogenic bladder is one of those more common ones. The bladder and the brain aren't communicating properly, and it's usually a result of some nerve damage. And it's in essence created the bladder to become ineffective.
One of the most common causes of urinary retention or bladder inactivity is spinal cord injury. But other possible causes include Parkinson's disease, multiple sclerosis, and spina bifida. Now, not everyone has this condition as a permanent situation. Some have temporary urinary retention that could be caused by surgery, a side effect of surgery, from prostate enlargement, or maybe from a bladder stone. Regardless of the cause, intermittent use of an in and out catheter is a useful way to empty the bladder and manage a bladder that is not functioning properly.
There are so many people out there that just have a little bit of a fear when it comes to catheterization. They think it's going to hurt, they think maybe they might get an infection.
Well, the concern is reasonable, but not everyone has a choice. Fortunately, with proper technique and the right equipment, both the concerns of discomfort and infection can be greatly reduced.
So Mary, it's about the equipment then.
There are so many different types and brands of catheters that are available in today's market. We have a few that are here, so let's take a look at what we have. This is an older product. This particular catheter is bulky.
Can I see?
It is difficult to handle, and it can cause some discomfort. It is also made of latex, so if you have a latex allergy, this is a product that you cannot use. There are other types of catheters that are available as well. There are different types of firmness. There are pre-coated hydrophilic catheters. We also have no-touch products. And in the no-touch, we're able to prevent touch contamination just from the design of a catheter.
Dale, I want to talk to you for a moment because you have such an incredible story that I think will help a lot of people get over any apprehensions they may have over using a catheter. Can you tell us your story?
Sure, Erica. I'm in a wheelchair, have been since I was age 20 due to an unforeseen tragedy. And so I had the spinal cord injury, I go to rehab, and in my mind I'm thinking, okay, you know, it's all about working my upper body so I can become independent because I'm paralyzed at this point. Well, I didn't realize that there's this whole other aspect of, you know, my bladder, my bowels are working differently. I had to learn how to use new products in order to catheterize. And so as a keynote speaker, I travel the country, so I needed a product that was amenable to my needs.
What I'm hearing from all of you is that if a doctor recommends you need a catheter for the short or long term, there really is no reason to hesitate.
We have a wonderful resource that's called Secure Start, and it will help you to find the latest information on lifestyle, clinical information. You can even have a personal advocate, and that personal advocate can help you find insurance as well as suppliers. It is a free service.
There was an incident that happened to me a couple of years ago that actually motivated me to call the Secure Start Services line. Josh, who is my personal advocate, walked me through not only just the resources, the information about the program, but also different types of products. And in fact, to this day, I use the VaPro No-Touch product, and that was all due to me calling the Secure Start Services line.
Wow, a real person. We want to thank you, Dale, for sharing your story, and thank you, Mary, for giving us all this great information that I know will help so many people overcome their apprehensions. And thank you, of course, Doctor, as always.
Thank you.
And in just a moment, have your legs ever gone to sleep while you're sitting at work? That can be a much bigger health issue than you think. For more information, go to our website, accesshealth.tv. We'll be back with more Access Health in just a bit.